Dr. Pan, good afternoon. Welcome.
Good afternoon. Thank you. See this popular bill. Mr. Chair, members, I present to you AB2109. This bill will provide accurate medical information to parents who are considering exempting their children from vaccinations, and certainly does not take that choice away from them. Bipartisan majorities of the legislature have approved requirements that children be vaccinated before they join other children at school or child care settings. The legislature has also ensured that parents can exempt their children from these requirements due to a personal belief. It is important that parents considering a personal belief exemption are informed with up-to-date, accurate information. And in fact, licensed healthcare practitioners are required by law to educate themselves about the latest medical research. AB 2109 ensures that expertise from over 150,000 licensed healthcare practitioners statewide is helping parents make this critical public health decision. As part of a regular visit to a doctor's office or clinic, the parent or guardian would receive information from the licensed healthcare practitioner who could then sign a letter at that point or later on stating that the information was provided. If a parent decides not to vaccinate their child and submits an exemption, the letter can also be submitted to the school or child care organization. With new outbreaks of diseases like whooping cough in Washington, Oregon, and California, as recently reported by NBC Nightly News on April 5th, it is important that parents understand the risk unimmunized children pass to their school, and the community. The conversation with a healthcare professional is critical to ensuring decisions about vaccinations are informed by the latest and most accurate information. So as a pediatrician, I know licensed healthcare practitioners consider themselves partners with parents in these decisions. We sit down, discuss vaccinations, and we'll sign the forms if the parents have a personal belief exemption. We have pediatricians from across the state here today who go on record saying they'll sign the form. Now I'd like to introduce Dr. Dean Blumberg, Chief of Pediatric Infectious Disease at UC Davis Children's Hospital. Dr. Blumberg is involved in clinical vaccine research, and he's also head of the infection control at Shriners Hospital for Children here in Northern California.
Thank you. Dr. Pan, just before we proceed with your witnesses, I apologize. I do want to lift the call on AB 2399 because of the dual referral.
Of course.
And so I'd like to ask the clerk to open the roll on call. Item 16, AB 2399. This is a do pass and refer to Committee on Labor and Employment.
Bonilla, Eng, Garrick, Hayashi, Hernandez, Lowenthal, Perez, aye, Smythe. That's 10.
That bill has 10. That bill is out. And again, I apologize for the interruption, but during our interruption, I also just want to confirm, Dr. Pan, you have accepted committee amendments on this bill.
Correct. Yes, I have. Committee amendments, certainly we want to include the osteopathic physicians. I know that we've had discussions with the naturopathic doctors where they were going to provide information, but I also understand they've talked to committee, and we will accept that amendment as well, where naturopathic doctors under supervision can also provide the exemption.
Thank you. And that is explicit in the amendments. We appreciate your acceptance of those amendments. And with that housekeeping, we will now proceed with your witnesses in support.
Thank you. As Dr. Pan mentioned, I'm Dr. Dean Blumberg. I'm Associate Professor and Chief of Pediatric Infectious Diseases at UC Davis Children's Hospital here in Sacramento. I'm experienced enough, well, I'm old enough that I have seen many of the vaccine-preventable diseases that are not very common today. And these diseases such as measles, such as polio, and chickenpox, are often thought of as mild diseases. Now, I'm the one who sees these patients when they're not mild, when these children who get these diseases suffer complications and end up in the hospital. So unfortunately, I've seen these children when they've had these diseases, when they've been sick, and some of them have suffered permanent damage, and some of them have unfortunately died. Now, these diseases are still around us despite vaccination because some of them you can't eliminate from circulation. And even if we do eliminate them from circulation in this country, they're only a plane ride away. And so they can be imported into this country. And that's why it's important to maintain protection and high immunization rates. Now, vaccines are safe, vaccines are effective, and vaccines have prevented much disability and death in children in California. But they don't work 100%. Nothing really works 100%. And that's why it's important to maintain a high vaccination rate. And it's also important to maintain a high vaccination rate to prevent those who can't be protected from vaccines, such as those who can't receive the vaccine because of a medical reason, such as having a cancer, children who have a medical contraindication to vaccination, or children who might be too young to vaccinate, or even children whose parents choose not to vaccinate their children. They're still protected from these vaccine-preventable diseases because there's less circulation with high immunization rates. School immunization requirements are important to maintain high immunization rates and to assure that children go to school in a safe and hygienic environment. Many parents may choose not to vaccinate their children. This, of course, is their choice. This bill does not infringe upon that right, but just make sure that they get the information that they need from a source that they trust, their child's health care provider. And this maintains the strength of California's immunization requirements for school and will maintain a safe and hygienic environment for children. For parents who can't, whose primary care provider may not sign the form, I'm sure there's others who will be willing to sign the form. I myself am willing to sign such a form after educating a parent and have been exploring with our clinic manager whether to open a clinic just for this purpose if there is a need. Thank you for your attention, and I urge your support for this bill.
Thank you. Next witness in support.
Yes, I would like to introduce Sarah Castro, a parent who supports the bill as a way to keep her son safe from vaccine-preventable disease. Ms. Castro.
Mr. Chair and members, my name is Sarah Castro. I'm a single mother of 3, and I'm here to support AB2109. AB2109 is an important bill because one parent's decision not to vaccinate their child is a potential hazard for me, my children, and our community. In addition to 2 teenage children, I am the proud mother of a special needs child. Every day presents itself with challenges that are unique to my son. The last thing I need to have to worry about is my son contracting a serious disease or having my son's school closed due to a dangerous but preventable infection because another person, potentially unaware of consequences, decided not to vaccinate their child. I do not believe that AB 2109 deprives me as a parent of the right to make health decisions for my child. AB 2109 simply ensures that should a parent choose not to vaccinate their child, they are as informed as possible when they make that decision. This bill is crucial to ensuring the health of my child and the community. Thank you for your time.
Thank you. Other witnesses in support.
Catherine Martin, Director for the California Immunization Coalition, available to answer questions you have remaining, and to say that this is a very simple bill. We love children, we love parents, and we want to protect the entire state.
Thank you. Other witnesses in support.
Ryan Spencer with the California Medical Association. We're a co-sponsor on the measure, and we're in support.
Thank you. Now, other witnesses in support. Sergeants, please activate the floor mic and ask you identify yourself by name, affiliation, and support. Thank you.
Committee-1 representing the California Black Health Network. We're in strong support.
Dr. Jennifer Hone, representing the Colorado Medical Society as well, California Medical Association, as well as the Santa Barbara County Public Health Department, in strong support of this bill.
Dr. Aisha Sheikh, OBGYN, member of the Santa Barbara County Medical Society and the CMA, and in proud support of the bill.
Dr. David Lerman, representing Kaiser Permanente and the California Medical Association, in strong support. Thank you.
Dr. Miles Abbott, I'm a private pediatrician and the chair of the American Academy of Pediatrics in California, over 5,000 members, and I support this bill, and our members will sign the forms for the families.
Dr. Mona Patel from Children's Hospital Los Angeles and member of American Academy of Pediatrics. I will happily sign the form, and I will happily take care of these patients.
Dr. Vivian Lee, pediatrician at Children's Hospital Los Angeles and also a member of the American Academy of Pediatrics, and I am in strong support of this bill, and I would absolutely sign this form as well.
Dr. Dimana Dimitrova from Children's Hospital Los Angeles, also a member of the American Academy of Pediatrics. I would also sign this form for my patients.
Dr. Christine Ramirez, resident in training at Loma Linda Children's Hospital. I would proudly sign this form and take care of your children. Thank you.
Dr. Marty Baum, Director of the Pediatric Clinic at Loma Linda University Children's Hospital. I'd be delighted to sign the form and help in providing education for the parents. Thank you.
Dr. Weber, I'm a second-year resident at Loma Linda Children's Hospital, and I would gladly sign this form. Thank you.
Dr. Christine Botrell, I'm a pediatrician at Children's Hospital Los Angeles and a member of the American Academy of Pediatrics. I would happily sign the form and strongly support this bill.
I'm Catherine Ross. I'm a pediatrician at Children's Hospital Los Angeles. I'm an AAP member, and I support this bill, and I'd be happy to sign the form.
Dr. Megan Pearl, Children's Hospital of Los Angeles, a member of the American Academy of Pediatrics, and I would happily sign this form for any of my patients.
I'm Lauren Walker, a pediatrician in Oakland, California, representing American Academy of Pediatrics, and I will happily sign the form and take care of the children.
Dr. Christy Derrick, pediatrician at UC Davis in Sacramento, and also a member of the AAP. I will happily sign the form.
My name is Dr. Nicole Choi. I'm also a pediatrician training at UC Davis Children's Hospital in Sacramento, and I support this bill, and I will sign the form.
Missy Johnson on behalf of the California Pharmacists Association in support.
My name is Kamala Valabaneni. I'm a pediatric resident at UCLA and would happily sign this form.
Dr. Cyrus Haydarian, pediatrician, Children's Hospital Los Angeles, and I support this bill and would sign the form.
Dr. Eric Peters from Mattel Children's Hospital in UCLA would happily sign this form and support this bill.
Dr. Diana Guzzi, I'm one of the UCLA pediatric residents. I would happily support this bill and gladly sign the form.
I'm Dr. Alan Perry, Jr. I'm a plastic and reconstructive surgeon, member of the California Medical Association, and the medical director of the cleft palate program at White Memorial Medical Center in Los Angeles. I speak in very strong support of this bill. Thank you.
I'm Dr. Amy Grace. I'm a third-year pediatric resident at Lucile Packard Children's Hospital at Stanford and a member of the American Academy of Pediatrics. Would happily sign the form and in strong support of this bill. Thank you.
My name is Michael Hull. I'm a medical student at Stanford University School of Medicine, member of the California Medical Association, and very proud to support this bill.
My name is Arthita Desai. I'm a pediatrician in San Francisco, a member of the AAP and the San Francisco Medical Society. I strongly support this bill and will happily sign the form.
Sarah Zeitzman, I'm a third-year medical student at Touro University and a member of the California Medical Association in support of this bill.
Hi, my name is Dawn Kraitusa. I am a nurse, have a graduate training in public health, and also I'm a first-year medical student at Touro University, and I stand in support of this bill.
Hi, Dr. Juliette Knowles, a pediatrics resident at Lucile Packard Children's Hospital at Stanford University. I'm in strong support of this bill, and I would sign the form for these parents. Thank you.
My name is Dr. Peter Simon. I'm a pediatrician in San Francisco, a member of Academy of Pediatrics, and I would happily sign this form for my patients and their parents.
Hi, my name is Dr. Mimi Choi. I'm also a pediatrician in San Francisco and a proud member of the American Academy of Pediatrics. I'm here to support the bill today and would definitely sign this form for my patients and their families.
Hi, my name is Dr. Sohail Sood. I'm a pediatrician in San Francisco and a member of the American Academy of Pediatrics. In strong support of the bill, I'd happily sign the form.
Sudeep Kukreja, neonatologist and pediatrician at Children's Hospital of Orange County, and the Vice President of American Academy of Pediatrics, Chapter 4. I very strongly support this bill, and I will sign.
My name is Lynn Hunt. I'm President of the American Academy of Pediatrics Chapter in Orange County, and I'm in support of the bill and would be happy to sign the form.
Hi, I'm Dr. Erin Murphy from Rady Children's Hospital San Diego and member of the AAP. I would happily sign this form. I'm in strong support of the bill and would still care for my patients.
My name is Dr. Esther Lee, pediatrician in San Francisco. I support the bill and I would sign any form for my patients. Thank you.
My name is Dr. Muth. I'm a mother of 2 young children and a pediatrician in Los Angeles. I strongly support this bill and will sign the form for my patients.
Hello, my name is Dr. Vane from Long Beach Memorial and UC Irvine. I'm in strong support of this bill and I will sign this form.
Hi, my name is Dr. Mallon. I'm also from Long Beach Memorial and UC Irvine, and I'm in strong support of this bill and I would sign it for my patients.
I'm Dr. Elizabeth Trish, a pediatrician in San Francisco, and I support this bill and would happily sign the form.
I'm Dr. Amy Whittle. I'm a pediatrician at San Francisco General Hospital, member of the AAP, and I'd be happy to sign the form.
Doug Kim with the Primary Care Association. Our 900 clinics are in strong support of this bill.
Marissa Hernandez, medical student at UCLA and very proud to support this bill.
Teresa Anderson, Public Policy Director for California Academy of Physician Assistants, and we are in support of this bill.
Erin Givens on behalf of the Children's Specialty Care Coalition, representing over 2,000 pediatric subspecialists in California, in support.